Hi there, and welcome to Seniors Thrive Hub, the place where health meets wisdom and aging is a celebration. I'm your host, Kai, a nurse practitioner specializing in adult gerontology primary care. And today we're diving into the world of Medicare and Medicaid, the dynamic duo of healthcare coverage for older adults and individuals with limited income and resources. Before we jump into the nitty-gritty details, let's set the stage with a fun analogy involving a classic dessert, the banana split. Imagine Medicare and Medicaid as the ingredients for creating the perfect banana split for you. Each part represents a different component of this dessert, and together they make up a comprehensive healthcare plan. We'll start with Medicare. Medicare is a federal health insurance program for individuals aged 65 or older, certain younger people with disabilities, and those with end-stage renal disease or ALS. Eligibility typically begins at age 65 with a 7-month enrollment window surrounding one's birthday. But if you're employed with health insurance through a job with 20 or more employees, you can delay enrolling in Medicare without penalty. Let's break it down, shall we? First, we have Medicare Parts A, B, and D, which are like the base ingredients of our banana split that we will put together so we can make the perfect banana split at home ourselves. Medicare Part A, hospital insurance, is akin to the banana itself, providing the foundation for our dessert. It covers hospital stays, skilled nursing care, and hospice care, offering a sturdy base for our healthcare needs. However, it does not cover nursing home or custodial care, most dental care, dentures, eye exams for glasses, or cosmetic surgery. For most individuals who have lived and worked in the U.S. for at least 40 quarters, equivalent to 10 years, and paid Medicare taxes, Part A premiums are waived. Otherwise, premiums are based on your years of U.S. work and Medicare tax contributions. For example, in 2024, if you work for 7 years, your monthly premium would be $278. And note, the years do not have to be consecutive, it's cumulative. Part A operates on a fee-for-service model where you only pay deductibles, co-pays, or co-insurance when services are utilized. So if there is no inpatient hospital stay or skilled nursing facility stay, you don't pay. The inpatient hospital deductible for 2024 is $1,632 per 60-day benefit period. I want to point out that 60-day benefit period as this can repeat, meaning you could potentially pay this deductible more than once if you have multiple hospital stays throughout the year. Medicare Part B, medical insurance, acts as the ice cream, offering coverage for outpatient visits, doctor services, many preventative health services, durable medical equipment, and more. Everyone pays a monthly premium for Part B, which is deducted directly from your Social Security checks or paid separately. The standard monthly premium for 2024 is $174.70, but it can be higher for high-income earners. Additionally, there's an annual deductible of $240 and a 20% coinsurance for most services. Part A and Part B, the banana and the ice cream, make up what is referred to as original or traditional Medicare, as these were the first two plans offered. Now, the cherry on top, Part D, prescription drug plan, covers prescription drugs. Part D is an optional coverage plan through private insurance companies approved by the federal government. Most outpatient prescription drugs are covered as well as additional adult immunizations such as shingles and tetanus. This coverage can be a part of a Medicare Advantage plan, which I'll cover later, or a standalone Part D plan alongside original Medicare Part A and Part B. Part D plans typically involve the premium and copay, so it's essential to choose a plan that covers your specific medications, as coverage and costs can vary based on the medications each plan will cover. So we have the banana, the ice cream, the cherries. But what is a banana split without extra toppings? A Medigap plan is like the toppings for our banana split. Just the sprinkles, hot fudge, and whipped cream add extra flavor and enjoyment to the dessert. A Medigap plan enhances original Medicare. Medicare supplemental insurance, or Medigap, is extra insurance you can buy from a private health insurance company to help pay your share of those out-of-pocket costs, like the co-payments, the co-insurance, and your deductibles from your Part A and Part B plans. Generally, you must have original Medicare, Part A hospital insurance, and Part B medical insurance to buy a Medigap policy. It's an optional addition that can make your healthcare experience more satisfying and worry free. And just like that, we reviewed Medicare Parts A, B, D, and Medigap supplemental insurance, which are like the essential ingredients of our banana split. But what if you prefer a pre-made banana split? You opt to visit the ice cream shop instead of buying the individual ingredients and making it yourself. So enters Medicare Advantage plans, also known as Part C. These plans bundle together parts A, B, and sometimes even D into one convenient package, offering comprehensive coverage with added perks like dental, vision, hearing. It's like getting the whole banana split ready to enjoy without the bother of assembling it yourself. Medicare Advantage Plan, or Part C, is an optional plan offered by private insurance companies in partnership with Medicare. These plans vary in coverage and cost across states and companies, but are required to offer everything included in original Medicare Parts A and B. Additionally, most Medicare Advantage plans cover benefits not included in original Medicare, such as dental, vision, hearing, and prescription drugs. Costs for Medicare Advantage plans, including premiums, copays, and coinsurance, are set by each plan rather than standardized by the federal government. Additionally, these plans often require you to see doctors within their specific networks, unlike original Medicare, which allows you to see any provider nationwide. Now let's talk about Medicaid, represented by the plate or dish that holds our banana split. And if you're low income and qualified, this dish will be provided for you. Unlike Medicare, which is a federal program primarily available to individuals aged 65 and older, Medicaid is a state-managed program aimed at providing free or low-cost health coverage to various groups regardless of age, including low-income individuals, families, pregnant women, seniors, and those with disabilities. While each state administers its Medicaid program according to federal guidelines, many have expanded eligibility criteria to cover more low-income adults. Essential services like hospital care, physician visits, and home health services are federally mandated, but states can also offer additional optional benefits like prescription drugs and dental care. Applying for Medicaid can be done through the health insurance marketplace or directly with your state's Medicaid agency, with eligibility based on factors like income, family size, and citizenship status. Medicaid ensures that people have access to essential health care regardless of their financial circumstances. I've included a link in the description for the Medicare and Medicaid websites so you can dig a little deeper based on your individual situation and where you live, because these things make a difference. And there you have it, folks. Medicare and Medicaid, the dynamic duo of healthcare coverage, explained through the lens of a banana split. Whether you prefer to build your own dessert with Medicare Parts A, B, D, and a Medigap plan, or you opt for the convenience of a pre-made treat with Medicare Advantage plans, these programs are here to support your healthcare needs. And for those facing financial challenges, Medicaid is ready to step in and provide support and necessary assistance for comprehensive coverage of your healthcare needs regardless of age. So, whether you're enjoying a banana split or navigating the complex world of healthcare, remember that you're covered. That's all for today's episode. Thanks for tuning in, and be sure to join me next time for more insightful discussions on health and wellness for older adults. Until then, stay informed, share this with a friend, and keep enjoying life's sweet moments. Bye.